Have you ever experienced that moment? Everything's set, perfect mood. And when the time comes, nothing. And you think, that's it doesn't work anymore. But is it really like that? Is an erection all or nothing? Or could there be myths about sexual performance that are generating unnecessary anxiety? Today, I'm going to debunk 7 myths about erection and sexual performance that impact millions of men over 50. Get ready for truths nobody tells you. Let's go. Myth number 1. If the erection doesn't come quickly and strongly, you have erectile dysfunction. Wrong. After 50, it's completely normal for erections to take a bit longer to appear, require more physical stimulation, not be as rigid as at 20, need longer foreplay. This is not dysfunction. It's biology. A study by the Brazilian Society of Urology revealed 68% of men 50+ report that erections are different at 50 compared to 30. But 72% still manage to have satisfying sexual relations. The issue isn't the erection. It's the expectation that it should be the same as at 20. When you expect instant erection and fail, you create anxiety. Anxiety worsens the erection, and the vicious cycle begins. Truth, erections at 50+ are different, not worse. Adjust your expectations. Next myth. Myth number 2. Erectile dysfunction is all in your head. Not always. After 50, most dysfunctions have a physical cause: cardiovascular problems, diabetes, high cholesterol, obesity, medication side effects. A study from Hospital d'Assay Clinicas showed 82% of men 50+ with erectile dysfunction had at least one undiagnosed medical condition. Erections depend on blood flow. If arteries are clogged with plaque, blood doesn't reach the penis. It's pure physics. When someone says it's in your head, they're minimizing a real problem. Erectile dysfunction is a warning from your body. Take it seriously. See a urologist. Get blood tests done. Evaluate cardiovascular health. In many cases, improving cardiovascular health naturally restores erections. Truth. After 50, erectile dysfunction usually has a physical cause. Don't ignore it. Next myth. Myth number 3. If you take Viagra or Cialis, everything goes back to normal. It's not that simple. Viagra and Cialis work by temporarily increasing blood flow, but they don't resolve the root cause of the problem. If the cause is poorly controlled diabetes, obesity, high cholesterol, chronic stress, the medication will work less over time. A Brazilian study demonstrated men who take Viagra but don't change lifestyle. Effectiveness drops 40% after 2 years. Men who combine Viagra with exercise, diet, and weight loss, many stop needing the medication after 6 to 12 months. Viagra is a facilitator. It's not a permanent solution. If you depend on medication, you're ignoring the real problem. Truth, Viagra helps, but lifestyle change is essential. Next myth. Myth number 4. If the erection isn't 100%, you can't have sexual relations. False. You don't need a 100% erection to have satisfying sex. A 70–80% erection is sufficient for penetration and pleasure, but many men give up when the erection isn't perfect. This creates more anxiety, and anxiety worsens the erection even further. A sexology study showed couples who accept partial erection and continue 78% sexual satisfaction. Men who stop because erection isn't perfect, 31% sexual satisfaction. The difference isn't the erection, it's the attitude. Sex doesn't need to be an Olympic performance. It can be connection, pleasure, intimacy, even with partial erection. Truth, a 70–80% erection is enough. Don't give up. Next myth. Myth number 5. Watching pornography helps maintain desire and performance. On the contrary, pornography harms real sexual performance, especially after 50. Why? Pornography creates unrealistic expectations. Always instant erection, perfect body, effortless performance. When you compare real sex with pornography, you fail, and anxiety destroys your erection. An Italian study revealed men 50 plus who consume pornography daily, 56% report erectile dysfunction with a real partner. Men 50 plus without pornography, 22% report erectile dysfunction. Pornography desensitizes the brain. You need increasingly intense stimuli to feel pleasure, and real sex cannot compete. If you struggle with erection with a real partner but succeed with pornography, the problem is not physical, it's neurological. You've trained your brain incorrectly. Truth: excessive pornography damages real erection. Reduce or eliminate it. Next myth. Myth number 6. If you have morning erection, your sexual health is excellent. Not necessarily. Morning erection indicates your vascular system is working, but it doesn't guarantee you'll have an erection during real sex. Why? Because erection during sex depends on vascular system, physical, mental stimulation, psychological, emotional connection, relational, absence of anxiety. Morning erection is just a test of the physical system. On the other hand, if you don't have morning erection, that is a warning sign. It may indicate vascular problems, diabetes, or low testosterone. In that case, see a doctor. Truth: morning erection is a good sign, but doesn't guarantee sexual performance. Lack of morning erection is a warning. Final myth. Myth number 7. Premature ejaculation is a young man's problem. After 50, it only gets better. That's not true. Premature ejaculation can emerge or worsen after 50 years. Why? Performance anxiety. Fear of losing the erection, so you rush. Hormonal changes. Prostate issues. A Brazilian study demonstrated 28% of men 50 plus develop premature ejaculation for the first time after 50 years. The good news? Premature ejaculation has treatment, breathing and control techniques, Kegel exercises, strengthen pelvic floor, delay creams, specific medications if necessary. Don't accept it as normal for your age. It's treatable. Truth: premature ejaculation can appear after 50, but has a solution. Recapping. The 7 myths. First, erection at 50 plus doesn't need to be immediate and perfect. Second, erectile dysfunction usually has a physical cause, not just psychological. Third, Viagra doesn't solve everything without lifestyle changes. Fourth, 70–80% erection is sufficient for satisfying sex. Fifth, pornography harms real sexual performance. Sixth, morning erection doesn't guarantee sexual performance. Seventh, premature ejaculation can emerge after 50, but is treatable. What does this mean? Sexual performance after 50 depends on physical health, exercise, nutrition, disease management, mental health, reducing anxiety and unrealistic expectations. Real connection. Focus on your partner, not on performance. Leave in the comments, which myth surprised you most? If this video helped you, hit the like button. If you know someone who needs to see this, share it. If you want more content about male sexual health, subscribe to the channel. See you in the next video.